What's going on, everyone? Happy Saturday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Saturday edition of the Pandemic Update for Saturday, April 6th, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. So if you want to stay informed, subscribe to my channel down below. Give this a thumbs up if you like the content, and of course share this with anyone you know. If you have anything to say, leave a comment down below. Alright, today we're going to look at some news stories, we're going to take a look at some data, and we're also going to take a look at some stuff that we normally would look at on a Saturday, such as hospital data. Alrighty, Italy. COVID infections are decreasing in Italy at this time. However, deaths have increased slightly. From March 28th to April 3rd, new cases, 505. That's down by 16.3%. Likely an undercount, as you know. It's the same deal with here. You know, the at-home test and other people not getting tested. All that doesn't get counted in. Reinfections make up 40% of the cases. Deaths, 21. That is up by 5%, and the positivity rate is just 0.5% over there. Hospitalized, 732. That's down by 2.9%. And in the ICU, 22. That is down by 12%. And rather interesting to see that they had 732 people in the hospital with just 505 cases. That's telling me that, one, they're not testing enough, and two, some of these hospitalizations, they could be long-term. I mean, 505 cases, but yet they have that many people in the hospital? Rather interesting, if you ask me. All right, moving on to this now. Here in the United States, a respiratory illness forces St. Mary's County Animal Shelter to pause operations. Now, this is in Maryland, and when we read the story, the St. Mary's County Animal Adoption and Resource Center is announcing a temporary pause to adoptions and non-emergency animal intakes in response to a sudden outbreak of a contagious upper respiratory illness impacting several of the center's dogs. Testing has been conducted to verify the illness type and severity. Results are pending. If you want to read this full story, we have tweeted this out on our Twitter page. Well, damn it. I know, I hate to say that word, but it really is a Blink-182 song. Blink-182 has canceled 3 Mexico City shows due to illness. It's not saying what it is. It says acute, well, actually kind of is saying what it is. It says acute throat infection and severe bronchitis. We are seeing so many musicians with various different illnesses since the start of this pandemic, and I can tell you for a fact, prior to the pandemic, you know, I was an avid reader of news. I don't ever remember this many bands canceling for illness pre-COVID. I just don't. Do you recall? Let me know down below. That would be a good let me know down below for today. All right. Finally, in sports today, I know we got a little sports segment today. The Orioles, the Baltimore Orioles, says Austin Hayes is battling an illness. He is feeling under the weather, and because of that, well, he was not playing yesterday. Who knows what that was, but as you know, it's springtime. Illnesses are back on the rise again, and in some places that could include COVID. We're going to take a look at some EMS calls in just a few moments, and you'll really see, yeah, illness, it's starting to rise in many places, especially here in Philadelphia. Yeah, concerning trend. What's not concerning is the air quality. For the majority of the country, it is fine. You just had this patch in the middle of the country from Texas on up through to the Dakotas where there are some slightly concerning air qualities. And then California. Yes, California is not as great as it was the past few days. A little bit of an air quality issue. It's still fireplace season out there. The rest of the country is doing fine. All right, now we come to this. 808 EMS calls yesterday in Philadelphia. It's back over 800 again. As you know, up until this week, it was in the 600s, multiple days in a row. Low 700s sometimes, and it's been trending higher, and yesterday pushed 808 EMS calls. Never something that we like to see. That is at a concerning level. Montgomery County, it's starting to get busy. It was slow earlier, and it's starting to pick up now. Chester County, just before I started this recording, and we'll see if that is still the case, was really, oh yes, it is. Wow. Look at, wow, there's actually a scroll bar here. Should we count how many calls there are? Not one, not two, three, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, I believe 22 calls active right now in Chester County, Pennsylvania. That's like borderline. They're going to be running out of ambulances pretty soon. Yes, and we're seeing a sick person multiple times. I also just saw, here it is, cardiac arrest, stroke, injured person. It's just, wow. Very busy in Chester County, Pennsylvania. Again, a sign of the times that things aren't, in some areas they're dropping, some areas they're not. There's just a lot of calls. It seems like we're back to winter levels again for call volume for EMS. And as you see here, it's not all COVID related. There's a lot of other things, strokes, cardiac arrest, things that maybe could be post-COVID. And then, of course, these injuries, that's obviously something different. Again, it is opening day of trout season here in Pennsylvania, which really is a big deal. A lot of people meet up with their buddies at their outdoor camps, hunting camps, hunting clubs for trout season. So that could cause COVID transmission. There's something else that could cause COVID transmission in Pennsylvania and in many other states, and that is the solar eclipse that's happening on Monday. I was just looking at some traffic cameras earlier. Folks heading northwest towards where the eclipse would be. The roads are absolutely packed. This is going to be a big deal, and I think it's going to lead to some increased spread. Maybe not even just in the towns that people go to. Remember, they're going to go to these towns. Then they're going to come back to where they live, and that's going to cause spread as well. Walgreens this week, 13.7% positivity rate. The prior week is 15.1%. Difference of down 1.4%. Testing was down as well. Wastewater, we'll take a look at that tomorrow. Now we need to take a look at some hospital capacity in the United States. We'll do maybe about 5 hospitals. Taking a look at the national level, it's at 75.3%. COVID-19 makes that 1.1% of those beds being used. Again, that is 75.3% of all beds being used. Influenza is 0.6% of the bed usage. ICU situation is at 70.2%. Beds being used. COVID-19 makes up 1.1% of that. Influenza 0.7% of that. Now let's come down to somewhere where we know there is constantly a problem, and that is Rhode Island. Look at Rhode Island here. And it actually dropped a little bit. This is some good news. 86.7% of beds are being used. COVID-19 makes up 0.6% of that. 1.2% is for influenza. And what's the ICU situation there? This is actually some good news. It's trending downward now. This is finally 81.8% of the ICU capacity is being used in Rhode Island, 0.4% for COVID and influenza at this time. And we need to look at your neighbor, because your neighbor, Massachusetts, is just having a problem. 81.1% of ICU beds being used, 0.9% for COVID and 0.9% for influenza. And when we take a look at total beds being used, yeah, it's 86.3% of your hospital beds are being used at this time. That's not good. 0.9% for COVID, 1% for influenza. Let's go down to Florida, shall we? I want to see what's going on there. Okay, things are getting a little bit better in Florida. 75.9% of all beds being used, 1.1% for COVID, 0.5% for influenza. Your ICU capacity, this is not better. This actually trended upward a little bit. 73.9% of all ICU beds are being used, 1.4% for COVID-19, 0.4% for influenza at this time. And when we go out to the West Coast now, let's go to Washington State and see what's going on there. Your ICU beds, you're using 76.7% of them, 1.1% for COVID, 0.4% for influenza. Total beds being used at this time is at 84.4%. COVID-19 makes up 1.3% of that, 0.4% for influenza. And let's do the Mid-South, shall we? What is going on in Texas? Because we do know that Texas, for COVID epidemic status, is starting to grow once again. Or was it influenza? We'll take a look at that in a moment. Texas, hospital capacity. Yeah, you're using a little bit more now. 80.3%. COVID-19 makes up 1.4% of that. Influenza makes up 0.5% of that. And when we take a look at ICU usage, that is at 82.4%. COVID-19 is at 1.7%. Influenza, 0.6% of that. And to be fair, let's go up into the Great Lakes. Let's see what's going on in Michigan. Michigan often has problems in the spring. And right now, for ICU usage, 75% of the ICU beds are being used, 1.2% for COVID, 1.5% for influenza. Inpatient bed use at this time, it's actually gone down a little bit. 77% of all beds are being used, 1.3% for COVID-19, and 2.1% for influenza at this time. We'll take a look at wastewater sites tomorrow. All things wastewater, that will be tomorrow. COVID-19 deaths in the last week are down by 20% in the United States. Hospital admissions, they continue to go down as well. 8,015, that's down by 15.3%. And taking a look now at epidemic status, yes, I was right for COVID. It's growing once again in Texas, and it is likely growing at this time in Kansas. Influenza is likely growing up in North Dakota, and it is growing once again in New York. That could be because of New York City. I'm not 100% certain. Doesn't actually tell me where that is for, but yes, it is growing there once again. Taking a look at the JN.1 variant, it makes up 86% of the cases. JN1.13 is at 10.8%. JN1.18 is at 1.6%. All right, taking a look at influenza, we can see there are still some areas that are high, but the majority of the country is either moderate or lower at this time frame and dropping, which is good to see, with exceptions to North Dakota. We mentioned it yesterday. North Dakota went a shade higher into the red now, which is in the high levels, so that is still problematic for you. Taking a look at New Jersey, 65 out of 70 hospitals reported, 248 hospitalizations, 39 discharges, 9 people on a ventilator, 29 people in the ICU. New York State, I'll refresh this, but it usually does not update on the weekend. 589 cases for you, and the hospital situation in New York State, we do want to refresh this to make sure it shows statewide, and we do see the hospital situation. They finished out the week with not dropping as much. You can see here, it's almost starting to just bounce off the bottom a little bit here. But again, this is much lower than last year's levels at this time. 558 hospitalized patients, 54 people in the ICU. All right, some closing messages. If you're going to be viewing the solar eclipse, maybe it's under the path of totality, or maybe you're just going to view the partial eclipse because you're not in the path. Please remember to have those special safety glasses on your eyes. You really don't want to look directly. You could really impair and damage your vision. It's not good to do that. Second of all, if you are going to stay at a place, try to, I know it's too late to book any reservations now, but if you were lucky enough to stay at a campground, that really is the way to go. If you're staying at a hotel, please mask up, eat your meals in your room, try to avoid restaurants. If you are going to do dining, do outdoor dining if possible. Again, places are going to be packed. I was looking at traffic cameras earlier, like I said. The traffic going, at least in Pennsylvania, going towards northwest Pennsylvania is just unheard of for a Saturday in April. Expected next weekend, which we'll be talking about tomorrow. Yes, there's going to be a big function up at Penn State. That's going to lead to some COVID spread next weekend. But again, just try and stay safe. Do it safely. Avoid large gatherings and crowds. And I know we're going to see pictures and videos and live streams on TVs of large gatherings, science groups, watching the eclipse. It's going to lead to some spread. Will it make the national levels go up? Probably not, but again, it's about localized areas. If one area is having a surge in COVID or other illnesses, guess what? And you live in that area, well, then you need to pay attention to what's going on in the area you are in and not the national trend. Because the national trend doesn't dictate, well, hey, the national trend's dropping, I'm fine. Okay, it may be dropping, but maybe there's a bunch of people getting sick and it's spreading in your community. That has much more meaning and significance to whether or not you're at a high risk of getting infected. And even when levels are low, they are much lower now across the country. Guess what? You can still test positive for COVID, and a lot of people seem to be surprised that, wait a second, I thought levels were dropping. Well, yeah, just because they're dropping doesn't mean you can't test positive for COVID. Alrighty, folks, I'll see you all again tomorrow. If you like this, thumbs up. If you want to see more videos like this, subscribe to my channel down below. Share this with anyone you know. And of course, if you have something to say, maybe you have a tip or something, leave it in the comments section down below. See you all again tomorrow for our wastewater bonanza. Until then, have a fantastic Saturday afternoon, and thanks for watching.